Let me ask you a question. Are you thrilled with your health? I mean, really happy. That's what's supposed to happen when you go to your doctor. But if you're watching this, you might still be suffering with osteoarthritis pain. All right, I have another question. What if we could offer you a better way to treat your joint pain? It can improve your condition by 60 to 100%. Would you be interested in that? Our program has been around for 18 years. We have multiple clinics nationwide, and we have several patents and trademarks in terms of what we do, which is why our patient outcomes are so high. Visco supplementation, that's what we do. We're injecting a natural FDA-approved substance that has been approved for over 40 years. We're putting in exactly what your body used to make, and it's making less or none of now. In the capsule of the knee, there's a fluid called synovial fluid. And when our bodies are creating that fluid, the hyaluronic acid created by it puts the cushion between the bones and lubricates the joints. As we get older and progress through the arthritic cycle, there's a lot less cushion between the bones and a lot less lubrication in the joints. So what we're doing is putting back what the body used to make. 19 years ago, our founder, Lance, had a very traumatic football injury in high school. He had to undergo several surgeries. When he was 22, his knee was stuck in extension, so he was on a crutch full time. He went to an orthopedic specialist in Tampa who told him, "You're not going to like this, and I understand you're young, but your knee is that of an 80-year-old. He was advised that he had no choice but to get his knee replaced. Lance's father is a physician, so when Lance went home, Dr. Liberti said, "You'll have 24 to 45 staples." And he said, "The surgery will require amputating a quarter of your leg." He explained the problems of surgery as well as the rehab being a 12 to 18-month process. Dr. Liberti started calling peers that he knew around the country. He came upon Dr. McGrath, who was based in Philadelphia. So Lance flew from Tampa to Philadelphia. He got 5 injections of hyaluronic acid. He got almost full range of motion back, wasn't using his crutch, and almost 19 years later is using that same knee. Now, I'm not telling you guys it's a magical wand. You're not going to leave here doing cartwheels, but it is highly, highly effective. Lance said, so here's an orthopedic specialist who treats the Tampa Bay Buccaneers, telling him he needed a knee replacement. And he had to fly 1,200 miles away, and a primary care doctor, not a specialist, did this treatment, and it worked. So when he was flying back to Tampa, he was saying, this is awful. We have all of these different things we can do when our back hurts, right? Special mattresses, physical therapy, acupuncture, chiropractic, all of these things. But with our knees, they do steroid shots and take us right into surgery. Lance convinced Dr. McGrath Sr. and Dr. McGrath Jr. to leave their practice and come and open up a clinic where we started in Cherry Hill, New Jersey. What they did was take everything natural, FDA approved, and clinically proven to help with osteoarthritis, combined it all together in what's called the Advanced Arthritis Relief Protocol. Again, the hyaluronic acid is part of our synovial fluid that lubricates the joint. It's specifically for cushioning and lubricating. We are putting back what our body's not making anymore. On a research study that was a 7-year trial done on 500,000 patients in the U.S., they looked at how many injections were given and how well it worked. There were some results at 1, 2, and 3 injections, but the big spikes, when it really started to have an impact for you, was at injection 4 and 5. So we know we have to do at least 4 to 5 injections to get as much benefit for you as we can. But it's also imperative that it gets to the right place. Hyaluronic acid is very thick. It's going to go where we put it. So if it doesn't get where we need it to go, it's not going to work. So we have a machine called a fluoroscope. It has a large screen, and we can see inside the knee. So we know 100% of every injection gets to the right place. We also know that without those machines, 41% of injections will not get to the right place. It's really important to do a guided injection. We have to see and make sure it goes to the proper place. We know we've got to do multiple injections, and we also know we need to make sure it doesn't get squeezed out of the joint when you stand up. Because if your joint space closes, your lubricating fluid we just injected is going to go out to the side. So to keep your joint space open, we developed and patented our own knee brace about 12 years ago. Are you going to wear it all the time? Absolutely not. The key with the knee brace is that we need to keep that joint space open so the lubricating injection can stay put and do what it needs to do. It also does two other things. It's a custom brace specifically fit to you that we've developed. It's going to push your anatomy closer to where it used to be, because when you have knee pain, you start to lean on the other knee and you're walking differently, and it puts you out of alignment, which causes wear and tear and pain. So we're trying to realign things. Essentially what we're doing is cushioning, lubricating, stabilizing the joint, decreasing the inflammation, putting things back closer to where they used to be. And then with that single hinge, it says, this is how this joint moves. Then you can rebuild that muscle memory. The knee brace is typically worn 6 hours after you get the injection, and in between injection days, a couple of hours when you're weight bearing. Because every step that you take with the brace, it's getting things realigned in the proper motion back. Then we may or may not recommend physical therapy or a home device that you can use on the couch. That's physical therapy helping to get your range of motion back. The way we determine what you need is fourfold. We're going to do an x-ray where we're looking at the foundation of the knee. Next, we'll do a physical examination, checking what's going on with the motion, and our providers are going to do a very deep dive into your medical history. Then we're going to do an arthrogram where we put a small amount of dye in your knee. If the dye comes back out, we know that there's a small tear that we can non-surgically repair. This happens 5% of the time. Not likely, but it's very important, because if the dye comes back out, the injection will too. So we need to get that repaired non-surgically, then start doing the hyaluronic acid injections. At that point, our providers are going to say what they recommend for your treatment. In terms of insurance, Medicare lets us do 5 injections. When insurance lets us do 5 injections, we get to give you the best treatment. And there's a big difference between 4 and 5. So once we know what the prognosis is, what the recommendations are going to be, after the x-ray and after everything else, if there's anything out of pocket, before we do anything and before we bill anything, we will tell you what's covered by insurance and what is not covered by insurance. Everything legally we don't have to bill for, we won't. The key is to get the care and not let the money issues, if there is any, sway you from the treatment. Anything we can do to make that simple, we will go over. When you come in on the x-ray day, you will wear loose clothes. The x-ray visit is a little longer because we're doing the x-ray, physical exam, and the history. It takes about a half hour. After that, each visit takes about 10 minutes. It's not painful. We numb the outside and the inside. You'll be able to walk. You'll be able to drive. You can come on your own. Osteoarthritis is a chronic condition, and it requires a systematic approach to get outside of the drugs and surgery paradigm so you can get better. Please do not wait and let your condition get worse. You may have noticed our sign at the front, Awesomeness Happens Here. We truly believe we're creating more awesomeness with each patient like you that we help. The practitioners who are using this AARP program really know what they're doing and are going to help you get the results you want so you can get back to living your life. So now it's time for you to decide. Do you want more from your health? Sit back and someone will be with you in a moment.